Should you have your child vaccinated? There is a movement across the U.S. and the world that condemns vaccination as dangerous or some government plot. However, history clearly shows that vaccination has saved more lives, and it's the crown jewel of public health. Joining me now to discuss this further is Dr. Tara Smith. Dr. Smith is an associate professor with the Department of Biostatistics, Environmental Health Sciences, and Epidemiology at Kent State University College of Public Health. In addition, she is the owner and editor of the blog Etiology. Hello, Dr. Smith, and thanks for talking to me today.
Thanks for having me on.
Perfect. The news lately has been inundated with Kristin Cavallari, Jenny McCarthy, and other high-profile people who choose not to vaccinate their children or are just outright against it for a number of different reasons. And you wrote in a blog post recently on Etiology, Why I Vaccinate My Kids, and that's why I wanted to talk to you.
Mm-hmm.
So, Tara, why did you vaccinate your kids?
So I do study infectious diseases, and unfortunately I know all too well about many of the diseases that we don't really think about here in the United States on a daily basis, about measles and mumps and polio and pertussis, and how nasty they can be. Measles is something that has been making a comeback a bit to the United States. We have a few outbreaks going on right now. And, some people think of that as just a mild childhood disease, but really it kills about 1 in 1,000 people who have it. Many more are hospitalized with pretty severe infections. And even those that survive, there's a very rare sequelae, something that happens after you get better, called subacute sclerosing panencephalitis, where basically people can, succumb to measles 5-10 years after they're initially have the acute infection. So there's all kinds of these things that, people don't really think about. And the vaccines have very low risk of any kind of serious adverse events. Most of the time, if you have a vaccine, the worst thing that's going to happen is that you might get a fever or some pain at the injection site. So for me, the risk of those diseases is much, much greater than the risk of vaccinating kids.
Yeah, and you also mentioned in your blog, things like MRSA and Group A strep and all that, and there is no vaccine for that. Right.
Yeah, I study Staph aureus. That's my, my organism of choice, and we don't have a vaccine, and it kills in the United States about 11,000 people every year. I also mentioned some other diseases like Group A streptococcus, Group B streptococcus, which is still causes a lot of meningitis, brain infection in little babies. Also don't have a vaccine for that. So, I see these type of infectious diseases that are still harming and killing, children and adults every day, and we don't have vaccines for those. So the ones that we do have vaccines, I'm very happy that, my kids can get vaccinated and not have to suffer from the actual infections.
Right. So when Kristin Cavallari says, and I quote, "There are very scary statistics out there regarding what is in vaccines and what they cause." Now, that's her decision, of course. I'm not trying to, bash her or anything, but is she misguided?
Yes, I would say she is. And there's a lot of really bad information out there on the Internet. And, she mentioned she had read a lot of books. And, indeed, I'm sure she has. But, there are books that are not written by professionals who study these types of things every day and who have a good background in the basic science and epidemiology and microbiology and immunology that, we study for years and years in order to get a grasp on the subject. And some people think that they can just, read a few websites on the Internet and, be an expert in the subject. So I would just disagree that she is putting out any kind of accurate scientific information.
Right. Now, I looked up and down for this, and I'm going to ask you, what evidence is available that links the measles, mumps, and rubella vaccine to autism? And the reason I ask is because there's a new survey that came out from the University of Chicago talking about medical conspiracies. I don't know if you saw that or not.
Yep, I did. Yep.
Yeah, and 20% of those surveyed believe that doctors still want to vaccinate children despite knowing the vaccines cause autism. So is there any real hard evidence, peer-reviewed journals, articles, anything concerning this?
Yeah, no, there's not. And, quite the contrary, there's actually now about 20 studies that have specifically confirmed that, no, there is no association between vaccines and autism. But it really goes back to a 1998 study by a doctor named Andrew Wakefield out of Great Britain who, put out this small case series in the journal The Lancet that suggested that the MMR, the measles, mumps, rubella vaccine, was associated with children developing autism. And that's been completely refuted. Actually, that study was withdrawn. It was found that Wakefield had a lot of undisclosed conflicts of interests and had actually fabricated some of the data. The Lancet actually withdrew the article. They retracted it. So, it in the scientific community, that idea is completely, bogus. It's been refuted. It's been examined and found to be lacking. But there's still a lot of that, these ideas that are spread on websites that suggest there is a link, and, a lot of anecdotal stories from parents that say that, their kid got the MMR and then was diagnosed with autism. So those are really the things that are kind of spreading that rumor right now.
Yeah, I mean, in my opinion, it's pretty sad. There's even a children's book out concerning this. I don't know if you've seen that. I don't have the title off the top of my head, but it's...
Oh, I don't think that I've seen that.
Yeah, I'll have to forward it to you sometime. You talked about the measles resurgence, and there was actually an article the other day saying that, the number of cases in California has been significant, let's say, since the beginning of the year. And they're saying that, a good portion of that are linked to people that were deliberately not vaccinated. And also a couple of years ago, I was, covering on the website the whooping cough outbreak of 2012, which was the highest in 50 years. So I guess I would like to close with this question. What would it take, Tara, to get people to take this more seriously, a more severe vaccine-preventable disease like diphtheria to break out in the United States before people, took it more seriously? I mean, what are your thoughts on that?
Yeah, I hope not. And, I really don't know, because even some of the, the websites that I read from people that, very vocally don't vaccinate, some of them, they mention their kids have gotten, vaccine-preventable diseases. They've gone through pertussis or something, and it still doesn't change their mind about vaccinating. For some of them, though, it doesn't change their mind because their kid did get better.
Right.
There have been cases certainly where, parents that were against vaccinating did lose a child from a vaccine-preventable disease, and that did change their mind. So, I mean, I really hope that doesn't have to happen. I can't even imagine the pain from, anyone has from losing their child. But I think that is going to happen. We are going to see a resurgence of some of these, vaccine-preventable diseases. We already are, and we're only going to be seeing more of it, unfortunately.
Right. Well, I've been talking to Dr. Tara Smith with Kent State University College of Public Health, and she is the owner of the blog Aetiology. I encourage you to check that out. Just type in Aetiology in Google, and you'll see some very good articles on her part. Thank you, Tara, for your time. I appreciate it very much.
Thank you.
You bet. Bye-bye.
Bye.